A spoonful of plain sugar can stop hiccups in seconds. Nurses keep packets ready on every shift for exactly this reason. Stay tuned because this video reveals 15 science-backed remedies that work better than most people realize. Number 9 is a meta moment about what you're doing right now that reduces anxiety. And number 14 cuts antibiotic-related diarrhea by about 40%. This content separates real remedies from internet myths. These aren't Pinterest theories. They're treatments backed by actual research that medical professionals use every day. Let's start with something everyone needs but nobody wants to hear. Number 1. Sleep and time. The most powerful remedy costs nothing and works for almost everything. Proper sleep and giving your body time to heal. Most people want instant results, not a lecture about bedtime. But here's what actually happens when sleep occurs properly. Your immune system kicks into overdrive during deep sleep phases. T cells that fight infections become more effective. Growth hormone repairs damaged tissues. Your brain literally washes out toxins through specialized drainage pathways discovered just a few years ago. Studies tracking recovery times show people getting 7 to 9 hours of quality sleep bounce back from illness 3 times faster than those sleeping under 6 hours. Time isn't just healing, it's your body's most sophisticated repair program running automatically. But what about when relief is needed right now, while that healing happens? Sometimes even a humble kitchen ingredient can help almost instantly. Number 2. Sugar for hiccups. Here's where that sugar trick becomes your secret weapon. Take exactly 1 teaspoon of regular granulated sugar. Place it on your tongue and let it dissolve completely. No chewing, no quick swallowing. This method works in clinical settings more times than anyone can count. The science is fascinating. Dissolving sugar stimulates specific nerve pathways that control your diaphragm. Hiccups are involuntary diaphragm contractions, and this nerve stimulation essentially hits the reset button. Medical literature shows success rates between 60 and 90% when done correctly. The key is patience. Let that sugar sit and dissolve naturally. Your kitchen just became more effective than most hiccup remedies people pay for. But if sugar seems too simple, here's an even more bizarre psychological trick that works just as well. Number 3. Hiccup conversation trick. Try this psychological approach. Ask someone with hiccups to recall exactly what they wore last Tuesday. Then immediately ask them to name their 3rd grade teacher. Watch what happens. This works because hiccups involve neurological patterns, and forcing complex memory retrieval interrupts those patterns. You're essentially overloading the brain's processing power, which breaks the hiccup cycle. Think of it as cognitive interference therapy. The questions must require deep thinking, not simple answers. Memory searches that span years work best because they engage multiple brain regions simultaneously. It's like pressing Ctrl-Alt-Delete on your nervous system. These quick hiccup fixes are impressive, but now let's explore remedies that take us back to grandmother's medicine cabinet, starting with the golden liquid that outperforms modern cough medicines. Number 4. Honey for cough. Raw honey outperforms many commercial cough medicines, and pediatric associations worldwide now recommend it as first-line treatment for nighttime coughs in children over 12 months old. Clinical trials comparing honey to dextromethorphan, the active ingredient in most cough syrups, showed honey provided equal or superior cough suppression with better sleep quality. The mechanism involves coating irritated throat tissues while delivering antimicrobial compounds directly to infection sites. Critical safety point: never give honey to infants under 1 year. Their digestive systems can't handle potential botulism spores that might be present. For everyone else, 1 teaspoon before bed provides hours of throat coating and cough relief. Darker varieties like buckwheat contain higher concentrations of beneficial compounds. Your kitchen cabinet just proved more effective than the pharmacy aisle. Staying in that same kitchen cabinet, there's another route that grandmothers worldwide have relied on for centuries, one that modern science now proves works better than many prescription nausea medications. Number 5. Ginger remedies. Fresh ginger contains bioactive compounds called gingerols that directly target nausea pathways in your brain and digestive system. This isn't folk medicine, it's biochemistry you can taste. Research demonstrates effectiveness for motion sickness, morning sickness, and chemotherapy-induced nausea. The therapeutic dose is approximately 1 gram daily, equivalent to half a teaspoon of fresh grated ginger or 1/4 teaspoon dried powder. For motion sickness, consume ginger 30 minutes before travel. Pregnant women can safely use up to 1 gram daily for morning sickness, though always consult your healthcare provider first. Make fresh ginger tea by steeping thin slices in hot water for 10 minutes. The crucial difference: real ginger versus commercial ginger products that contain minimal active ingredients. Fresh or properly dried ginger delivers compounds that actually work. Now, moving from the spice rack to the medicine cabinet, there's a pink liquid that deserves way more credit than just treating childhood chickenpox. Number 6. Calamine lotion extended uses. Calamine lotion deserves recognition beyond childhood memories of pink polka dots. This zinc oxide and ferric oxide combination treats poison ivy, insect bites, minor burns, and even inflammatory acne. Recent research convinced the FDA to list calamine as an effective skin protectant. The active ingredients create a drying, anti-inflammatory effect while forming protective barriers over irritated skin. Proper application technique: shake thoroughly, apply thin layers, and allow complete drying. Don't rub it in like moisturizer. The surface coating is part of the therapeutic effect. For acne, dab directly on individual blemishes before sleep. Multi-generational families often pass down calamine techniques because consistent results speak louder than marketing claims. These time-tested remedies work precisely because they've survived decades of real-world testing. But sometimes the most surprising discoveries happen when researchers study conditions that affect millions but get little attention, like the sleep problems that plague most people with ADHD. Number 7. Melatonin for ADHD. Here's something that surprises many people. Melatonin can significantly help ADHD symptoms, but not through sedation. The connection lies in circadian rhythm disorders that affect up to 75% of people with ADHD. ADHD brains often experience delayed sleep phase syndrome. Their natural bedtime arrives hours later than typical schedules allow. This creates chronic sleep deprivation that worsens attention, impulse control, and emotional regulation during daytime hours. Low-dose melatonin taken 2 hours before desired bedtime can gradually shift sleep timing forward. Start with 0.5 milligrams and increase slowly to 3 milligrams maximum. This isn't about forcing sleep, it's about gently realigning your internal clock. Always coordinate with healthcare providers, especially when taking other ADHD medications. For many people, addressing sleep timing becomes the missing piece that makes other treatments work better. Speaking of conditions that keep people awake at night, there's a skin condition that affects millions and responds beautifully to something most people eat for breakfast. Number 8. Oatmeal for eczema. Colloidal oatmeal earned FDA approval as an active ingredient for treating eczema and dry skin conditions. When oats are ground into fine powder, they release anti-inflammatory compounds called avenanthramides that reduce itching and irritation. You can purchase commercial colloidal oatmeal products or create your own by grinding plain oats in a coffee grinder until powder fine. Add this to lukewarm bath water and soak for 15 minutes. The oats form a protective, moisturizing film on skin surfaces. For localized treatment, mix colloidal oatmeal with just enough water to form a paste. Apply to affected areas for 10 minutes, then rinse gently. This technique is gentle enough for infant eczema, yet effective enough that dermatologists recommend it regularly. Clinical studies show oatmeal treatments match the effectiveness of some prescription moisturizers at a fraction of the cost. Sometimes the simplest solutions work best. And speaking of simple solutions, here's something fascinating. The very act of watching this video right now is actually providing therapeutic benefits for your mental health. Number 9. Video content for anxiety. What you're doing right now, watching educational health content, can actually reduce anxiety levels. Research shows that learning practical health information gives people a sense of control, which directly lowers stress hormone production. The neurochemistry is fascinating. Educational content triggers dopamine release in learning centers while activating prefrontal cortex regions that regulate emotion. You're literally getting natural anxiety treatment through the act of learning useful information. The key distinction: educational content versus doom-scrolling social media. Educational videos engage thoughtful brain regions, while social feeds often trigger fear-based responses in the amygdala. Choose your content consumption strategically for mental health benefits. This meta-awareness about how information affects your brain can help you curate better digital habits. Now, returning to physical remedies, let's explore a plant that's become so popular it's practically a household essential, and the science finally caught up to explain why it works so well for burns. Number 10. Aloe vera for sunburns. Aloe vera gel contains polysaccharides like acemanin that accelerate burn healing while providing immediate pain relief. The National Center for Complementary and Integrative Health confirms these effects through controlled studies. Fresh aloe from living plants provides the highest concentration of active compounds. Cut a leaf section and apply the clear gel directly to burned skin. Store-bought aloe works too, but verify at least 90% pure aloe content. Avoid products with alcohol or artificial fragrances that can worsen burns. Apply 2 to 3 times daily until healing completes. The cooling sensation provides immediate comfort, but the real therapeutic effects happen over several days as anti-inflammatory compounds reduce tissue damage and promote regeneration. Remember that repeated sunburns significantly increase skin cancer risks throughout life. Use aloe for treatment, but prioritize prevention and annual skin examinations with qualified healthcare providers. While aloe soothes external irritation, the next remedy tackles internal congestion using nothing more than salt and water, but the technique makes all the difference. Number 11. Advanced saline techniques. Nasal saline irrigation isn't just salt water. When performed correctly, it matches the effectiveness of some prescription nasal treatments. Allergy and immunologist specialists recommend it for sinus infections, allergies, and chronic postnasal drip. The advanced technique requires precise preparation. Use only distilled or previously boiled water. Mix half a teaspoon of non-iodized salt with 8 ounces of water. The solution should taste like tears, not too salty, not too bland. Execution matters. Lean over a sink, tilt your head sideways, and pour solution into the upper nostril using a neti pot or squeeze bottle. Gravity should carry it through your sinuses and out the lower nostril. Don't force pressure. Let physics do the work. This physically removes allergens, bacteria, and excess mucus while reducing inflammation in nasal tissues. Use twice daily during allergy seasons or active sinus problems. Proper technique makes all the difference between relief and discomfort. From clearing one end of your digestive system, let's move to the other end, where a humble dried fruit outperforms expensive medications. Number 12. Prunes for constipation. Prunes outperform many over-the-counter laxatives through a two-mechanism approach. Insoluble fiber adds bulk to stool, while sorbitol acts as a natural osmotic laxative. Sorbitol is a sugar alcohol that your digestive system can't fully absorb. It remains in your intestines, drawing water through osmotic pressure. This creates softer, easier-to-pass stool without harsh chemical stimulants found in many commercial laxatives. Effective dosing. Start with 3 to 4 prunes daily and increase gradually to 6 to 12 if needed. Most people see results within 6 to 12 hours. The gradual approach prevents cramping or excessive urgency that can occur with higher initial doses. Caution for IBS sufferers. Prunes can sometimes worsen symptoms in people with irritable bowel syndrome. Discuss with your healthcare provider before trying if you have diagnosed digestive disorders. Now prepare yourself for remedies that sound so ridiculous you'll question whether this is real medical advice, starting with something from the hardware store. Number 13. Duct tape for warts. This sounds completely absurd until you learn it has an official medical name: tape occlusion therapy. Multiple clinical studies demonstrate comparable and sometimes superior effectiveness to liquid nitrogen freezing treatments, but without pain or expense. The protocol: cover warts completely with duct tape for 6 consecutive days. On day 7, remove tape, soak the area in warm water, and gently file the wart surface with an emery board. Apply fresh tape and repeat cycles for up to 8 weeks. The mechanism likely involves oxygen deprivation weakening the human papillomavirus, while tape adhesive creates mild irritation that stimulates immune responses against the virus. Stickier tape varieties show better success rates. This method excels for children because it's completely painless compared to freezing or acid treatments. Your toolbox just became part of your medicine cabinet. From hardware store solutions to health store controversy, the next remedy has been oversold by marketing but undersold by science for one specific crucial use. Number 14. Probiotics. Probiotics face credibility problems because supplement marketing claims they cure everything, which is demonstrably false. However, one specific application has rock-solid evidence preventing antibiotic-associated diarrhea. Antibiotics kill harmful bacteria causing infections, but they also eliminate beneficial gut bacteria essential for proper digestion. This disruption causes diarrhea in approximately 30% of people taking antibiotic courses. Taking probiotics during antibiotic treatment reduces this risk by about 40%. The timing is crucial. Consume probiotics at least 2 hours separated from antibiotic doses and continue for several days after completing antibiotic treatment. Look for products containing at least 10 billion colony-forming units with multiple bacterial strains, particularly Lactobacillus and Bifidobacterium species. This represents one of the few supplement categories where evidence strongly supports specific medical claims. But now for the controversial finale, a remedy that's probably sitting in your refrigerator right now, one that millions of people still swear by, but that might actually be making things worse. Number 15. Soda for upset stomach. Here's the remedy that might have caused significant harm: giving carbonated sodas to people with upset stomachs. This practice raises concerns because it combines ineffective treatment with potential long-term health consequences. The original theory suggested ginger ale contained therapeutic ginger compounds. Modern commercial ginger ales contain virtually no real ginger, just artificial flavoring and substantial sugar content. You're not treating nausea, you're potentially worsening it by flooding an already irritated stomach with sugar. Research comparing sodas to proper rehydration solutions shows sodas fail to effectively replace fluids or electrolytes. Children consuming large quantities of soda regularly develop higher rates of obesity and metabolic dysfunction beginning in adolescence. For genuine ginger benefits, prepare fresh ginger tea or consume crystallized ginger. For rehydration, choose water with a small amount of salt and natural fruit juice. Your digestive system and long-term health deserve better than sugar water masquerading as medicine. You now have 15 scientifically backed home remedies that can handle most common health problems using items already in your house. From stopping hiccups instantly to healing burns faster than prescriptions, these simple solutions prove that the best medicine often costs pennies, not hundreds of dollars. Your grandmother wasn't just being frugal, she was being brilliant. These remedies work because they support your body's natural healing mechanisms instead of overriding them with chemicals. The choice is yours. Keep spending fortunes at the pharmacy for problems you can solve in your kitchen, or start using the wisdom that kept families healthy for generations. But if you think these household remedies are powerful, wait until you discover what happens when you add the one ancient oil that amplifies every natural healing process in your body. Click here to watch the 10 biggest black seed oil benefits you've been missing for years and how to use it right, and discover why this liquid gold has been called the remedy for everything but death.